Hi everybody, my name is Adam Pick and I'd like to welcome you to our ongoing video series about heart valve surgery from the patient's perspective. For those of you who don't know me, I'm actually a double heart valve surgery patient and author of a book by the name of The Patient's Guide to Heart Valve Surgery. Today we're going to be talking about a special type of aortic valve replacement surgery known as the Ross procedure. And I can imagine if you're watching this video, you may be suffering from some type of aortic valve disease. The different types of aortic valve disease you may be experiencing could be aortic stenosis, aortic regurgitation, also known as aortic insufficiency. Your valve leaflets could be calcified, or like me, you could have been born with a congenital heart defect known as a bicuspid aortic valve. Regardless of whatever your disorder is, I imagine you may be considering the Ross procedure as an alternative to more traditional types of valve replacements, which use mechanical valves or tissue valves, also known as biological valves that come from pigs or cows. So how does the Ross procedure compare to those more traditional types of aortic valve replacement? Well, you should know that the Ross procedure is also known as the switch procedure. And it's because the patient's diseased aortic valve is completely removed from the heart, and then the pulmonary valve is switched to the aortic position. Then a homograft, which is also known as a donor valve, is stitched into the pulmonary slot. That said, the Ross procedure is really a double heart valve replacement surgery. So now that we know what the Ross procedure is, I imagine that you would have some of the exact same questions I had as I was evaluating the Ross procedure. Let's examine those questions. So when I first met with Dr. Trento and Dr. Starnes for my consults, and they explained the Ross procedure to me, one of the questions I personally had was, when was the first Ross procedure performed and who did it? And in my research I found that the Ross procedure was invented by Dr. Donald Ross, and he first performed the procedure back in 1967. The other question I had about the Ross procedure was all about frequency. How often was this technique done? So that question was, how many Ross procedures are performed every year? And after doing a lot of research, I came across some estimates. Here's one of them by CryoLife, which suggests that about 1,500 Ross procedures are performed around the world every year. You might be wondering, is that a lot or is that a little? Well, considering that between 20 to 30,000 aortic valve replacements occur every year, it's not that much. However, as the data keeps coming out about the success of the procedure, it is believed that the rate and use of this technique will increase over time. One of the other big questions I had was all about surgical outcomes of the Ross procedure. That being, what were the success rates, or what were the failure rates, and of course, what were the reoperation rates? And I was able to find clinical data from 3 top surgeons that specialize in the Ross procedure. The first one was from Dr. John Oswalt in Austin, Texas, and he reported that his Ross procedure patients were 92% free from reoperation 17 years after their surgery. Then I saw some clinical data from Dr. Ed Rains in Lincoln, Nebraska, and he suggested that he's only had to redo about 3% of his Ross procedure patients during the past 10 years. Finally, I came across some data from Dr. Paul Stelzer of Mount Sinai Hospital in New York. And Dr. Stelzer has performed over 400 Ross procedures since 1987. And Dr. Stelzer's clinical results suggest that less than 10% of patients require reoperation up to 10 years after surgery. So what does the data tell you? Well, for me, when I reviewed that research, I found it very comforting. So much so that when it came time for my own aortic valve replacement in 2005, I chose the Ross procedure. Plus, there are two benefits you should know about. First, with the Ross procedure, you don't need to take anticoagulants like Coumadin if you were to be having a mechanical valve replacement. And secondly, I really liked knowing that I was going to be able to keep my own valve, although switched from the pulmonary to the aortic position, for hopefully the rest of my life. My point to you is that since I've had the Ross procedure, it has been a complete success for me. So since Dr. Von Starnes performed the Ross procedure on me at USC Medical Center, I've been incredibly lucky. I've married the girl of my dreams, that's Robin, my wife, and I've re-engaged with all the physical activities that I enjoyed prior to heart valve surgery. That being hiking, swimming, surfing, running, and even scuba diving. And finally, in April of this year, Robin and I welcomed our first child to the world, and that is our son Ethan. So I hope this has been a helpful introduction for you about a special aortic valve replacement known as the Ross procedure. If you'd like to learn more about the Ross procedure, simply go to my website. Here's the address. You can go to www.heart-valve-surgery.com. Or if you're at Google, just type in Adam Pick into the search field, and I should be one of the first results that comes up. Finally, I'd like to wish you all health and happiness, and most importantly, keep on ticking. Thanks so much.